Okay, hello, everybody. Thank you so much for joining us this afternoon. My name is Dunia Elvir. I'm a news anchor for Telemundo 52, and I want to welcome you guys to Healthy Moms, Strong Babies, Expecting a Baby, and Caring for a Newborn during COVID-19 pandemic. This is presented by Marsh of Dimes, California, and supported by Cedar Sinai. We are very happy to be here. As you can see, we have three experts. I'm going to introduce the three of them. I'm going to start with Dr. Natalie Assis. She's a clinical associate professor of obstetrics and gynecology, the director of perinatal infectious diseases, and the director of the Central Valley Perinatal Services with Stanford University School of Medicine. She's also dedicated March of Dimes volunteer. Thank you, doctor, for being with us.
Thank
Dr.
you.
Thank you. Dr. Alexandra Adowaten. She's a psychologist who specializes in maternal mental health, also perinatal mood disorders and postpartum depression. Dr. Alexandra also oversees the Maternal Wellness Collaborative of California. Doctor, thank you for sharing your time with us.
Thank you.
Shantae Ball, she is a maternal child health director of the March of Dimes in Fresno. In this role, Shantae focused on improving access to healthcare through cross-sector partnership. And I want to thank you too for being here because you're going to give a lot of good information to the moms out there.
Thank you.
Thank you, ladies. And well, I want to remind everybody that it's connected with us, that we are open to questions through Facebook. And also, I share this in Facebook, March of Dimes, California. And we'll be happy to answer all of the questions that you guys have today. The intention of this conversation is to help moms to feel that there's help out there. You're not alone in this time, in this process. So I'm going to start with Dr. Assis. I would like to start with you asking the basic. What is COVID-19? It's the same as coronavirus. And if this is the same as the regular flu, doctor.
Thank you, Donia, and it's a pleasure to be here. Those are all great questions. So to begin with, number one, the coronaviruses are a group of viruses that cause the typical cold virus, for example, but they also can cause severe respiratory viruses. And COVID-19 is one of these members of the coronavirus that was first detected in 2019, and it was associated with severe pneumonia. Given that it's a similar virus to influenza, meaning it causes respiratory symptoms. However, it is not the same. They are in different classes, and unfortunately, we do not have vaccines nor antivirals that are readily used for coronavirus or COVID-19 at this time. However, we are exploring those routes, as we all know.
Okay, now I'm going to go with Dr. Alexandra. Doctor, from your experience, we are in a very stressful time right now for everyone, but particularly for pregnant women. What are some signs of stress that they're going while they're, expecting a baby?
Yes, thank you. And it's a pleasure to be here. So when a mom is pregnant and feels stressed, usually they lack patience with others around them. They might feel irritated within their body. They might just be a little bit moody. The extra stress of taking care of the other children within the home, being locked down and not being able to go to their local park, are just signs of stress where you just feel like, what can I do? And so I know later on we're going to get into some ways to alleviate some of that stress, but really it's about being snappy and not being able to just hold your temper.
Yeah, and it's important to identify the difference when you are one of the family members because sometimes you can try to help, and far from helping, you irritate the mother even more.
Yes, you feel more on edge and very irritable, right?
Yeah, and that's scary, especially when you're expecting a baby. Well, let's talk with Dr. Assis. What are the symptoms of COVID-19 virus?
So similar to respiratory tract infections, and influenza-like symptoms, we have the typicals. There's coughing, there is shortness of breath, there may be a runny nose, there may be sneezing, also fevers or chills. And interesting, as well as muscle pain or joint pain, sore throats. And interestingly, with coronavirus or COVID-19, we've also noted that in this virus particularly, there is also a new onset of lack of smell or lack of taste, which is unique or more unique to this virus. And also similar to the H1N1 virus that we experienced, we also seem to have a component of gastrointestinal symptoms. So there may be nausea, vomiting, diarrhea. So we take the typical respiratory tract infection virus symptoms, influenza-like symptoms, but also add on another layer for COVID-19 specifically, which is lack of taste, lack of smell, and gastrointestinal symptoms. Those are the ones that have been reported thus far.
Okay. And for example, for Shantae, if a woman does not have health insurance coverage, how can she get it? Especially that she's experiencing not only the normal situation of being pregnant, but these extra symptoms that will attack her and she'll feel anxious.
Thank you. That's a really good question. So first, I want to say that California really is a great state to live in terms of access to health coverage and health insurance. So in California, we have something called the Medicare Access Program. And this program is for pregnant women who are not covered, for example, by private insurance, or they're not covered by Medi-Cal. It's a low-cost, comprehensive coverage program. And I also really want to emphasize that your documentation status here is not applicable. So it is solely just based on the fact that you are pregnant, you're in California, and in California, we really want to support access and healthy maternal child health outcomes. And so in addition to that, if you're pregnant and you are part of the Medi-Cal Access Program, once your child is born, your baby is now eligible to be part of the Medi-Cal Access Infant Program, which is also comprehensive. And so there's more information that you can find here. I know our team is chatting in resources, but I just want to emphasize in California that we have multiple ways that women can gain access to care, either just straight Medi-Cal or through the Medi-Cal Access Program.
Okay, so you're saying it doesn't matter if they have or they don't have documents, right?
Correct. Exactly. So just to make sure that's really clear, in California, our number one goal is to make sure that we have healthy moms and healthy babies. So in California, if you are pregnant, you do not qualify for Medi-Cal and you do not have private insurance, you are encouraged to apply for what is called the Medi-Cal Access Program. And this is a low-cost, comprehensive prenatal coverage program for pregnant women in California. And the coverage then extends to infants as well. So there will be some slight, I guess, differences depending on who's administering the Medi-Cal program. So we have, Blue Cross, Anthem, et cetera. But in general, if you are pregnant in California, apply for the Medi-Cal Access Program.
Okay, and also, go ahead.
That also applies to
may I
mental health. It also applies to mental health. You will now be able to access a therapist through that same coverage.
Thank you, Dr. Alexandra. I appreciate that. And Dr. Aziz also.
Yes, I just wanted to add, Shantae, if I could, thank you, that I so support and want to get that message out there to our patients and our viewers. And many clinics will actually help with that process and have individuals who are there to help with that process. So you do not have to wait until you have the formal approval. A lot of clinics will start your health care and will also start that process to apply so that you can begin to get prenatal care as soon as possible. As we all know, it's, our prenatal time is not forever. It's finite. We have about 40 weeks. So the sooner you come in, the better. And again, there are many programs and many clinics, and especially at university centers, that will start to see patients while they are in the process of getting their insurance. So please, I encourage everybody to please come in for care. We love to take care of pregnant women and their babies.
Thank you so much, Dr. Aziz. That's so important, and I really appreciate you pointing that out. Some of our listeners actually might have a question about, for example, how long does it take? In general, the Medi-Cal Access Program takes like 4 business days or less to get an answer, but also I want to put out there, going back to what Dr. Alexandra and what Dr. Aziz has said, is that we also, in California, we have something called presumptive coverage. So basically just call the doctor and show up.
That's important.
In California, we will figure it out.
It's
That's
important
the
to send this message too for our teen pregnant ladies. We don't have a high percentage like we used to have back in the 90s, but we still see a lot of teenagers, they're pregnant, they don't know, they don't have the information. It's scary to be pregnant, to be a teenager. I was a teenage mom, so it's scary. So for those that are watching and they are young ladies and they don't have any issues with documents, it's just the fear of the age and being pregnant, Marshall Dimes also helps a lot. They helped me a lot when I was pregnant. My first child, well, 3 out of my 4 are preemies, so I know exactly the type of help Marshall Dimes give. And like Shantae and the doctors are saying right now, the help is for everybody, with, without documents. It doesn't matter the age. And we want to make sure that we have in this conversation a good, strong message for strong moms, strong babies, healthy moms, healthy babies during this COVID-19, which is a very difficult time. It changed our life dramatically. We may not go back to what we know as the normal stage. We may go to a new normal. And with this new normal, we're going to experiment a lot of problems of adjustment. So this is taking me with Dr. Alexandra. How can we relieve some of the feelings of stress or depression that we may have as a pregnant moms?
Yes. So typically as women, as mothers, we tend to take care of our babies and our families first. And I say that that is an answer that is not correct. By no means. You need to take care of yourself first. If you don't take care of yourself, you're no good to others. And I often say, when you go on an airplane, the pilot and the stewardess say, you put the mask on yourself first and then your children. And some of the ways you could take care of yourself is find activities that you enjoy doing and go back to basics. It could be coloring, it could be cooking, and really just feed into your soul. And then you'll have the energy to feed into others. I also am really an advocate of meditation and mindfulness. Just giving yourself space from your children, whether they're newborn or teenagers, just giving yourself 5 minutes of peace and quiet time for you, and then you'll be able to take care of your children.
Okay, perfect, doctor. I have a question from one of the moms that it's coming on Facebook. This is a mom, has a 6-month-old and wants advice on keeping baby safe when going out to doctor appointments and simple errands like grocery shopping. So let's start with Dr. Aziz. What will be your recommendation for this mom? I didn't get the name, but thank you for connecting with us.
Yeah, thank you. That's an excellent question. And there's probably multiple ways of perhaps strategizing for this. One of the things is obviously if someone is a sole caretaker or has a partner that's working and they are the only caretaker at that time for the baby needs to go with them. Ideally, if we have a family member at home who's healthy and well and can be with the baby, that would be the ideal or optimum solution to this. But in all reality, most of us don't have that type of a situation. And when our babies are with us and exclusively with us, I think things that are important are probably carrying them in their car seats and perhaps covering them with some type of a nice blanket that's thick enough and perhaps sheer enough to not allow substances, for example, to go through. So I would say some of the very, very thin cotton blankets that sometimes get even frayed may not be the best example of that. So I would use more of a thicker cloth to help protect the baby. And I would say that if it can keep the sun out, it probably is a good thickness to keep out other virus particles that are in respiratory matter, for example. So I think that's one way of thinking about it. The other, as Dr. Alexandra said, is keeping mom healthy. And it's something that we all should implement, all of us.
Yeah.
So again, keeping mom masked when she goes out, having mom wash her hands when she comes back from the grocery store and before she handles the baby, cleaning the baby carriage parts, for example, with disinfectant, and sometimes as easy as just alcohol, for example, rubbing alcohol. So those would be some of the things that I would recommend. I think that's a really great question, and that's something that you don't think about that often, but it's very, very important. So thank you, audience member, for bringing that up.
Thank you, Doctor.
And
That takes me to ask Shantae, if someone thinks they have COVID-19, where should they get tested and go for care? Because, you know, they're afraid to go out, but many people don't know where to get tested, especially if they don't have health insurance, Shantae.
Thank you. That is the million-dollar question, and it is such an important question. And so first, I want to sort of follow our general rules, which is contact your provider. Well, we know that a lot of folks don't have providers, right? So then the next step would be check with your local county health department. And if that also is not a viable option for sort of understanding the process of how to get care, I want to just really emphasize that I'm so proud to be a Californian right now, because our governor really has taken the lead in terms of making sure that we're increasing access to testing. Just last week, the state of California announced 36 additional testing sites in California. So 36 counties now have testing sites. And I want to emphasize, your documentation status is not part of the triage process to decide whether or not you get a test. It is testing in the community. There's no cost, so you don't have to provide health insurance information. And the easiest way to find out if there is, where the closest testing site is for you is to go to testing.covid19.ca.gov. And also, as I understand it, the governor's, he's still working on this, but the first phase of this was to ensure that folks had less than 90 minutes to drive to get to a testing site. I know that several counties have already rolled out and implemented, and they are fully functional. So call your healthcare provider, call your county Department of Public Health, but get on testing.covid19.ca.gov. Put your zip code in, and it will let you know the nearest testing site for you.
Yeah, actually, I went into that site yesterday, and it's very effective, it's quick, and it gives you the information near your community. And it's a tool that we have in the state of California. Dr. Alexandra, I want to ask you, at the beginning of the conversation, we talk about that you were going to mention some of the signs of a woman should seek professional help for her feelings, because it's not the same just to be a little bit, irritated, snappy. And there's a difference when they really need to seek for professional support.
Most definitely. So postpartum depression, it's been retermed as perinatal mood and anxiety disorders. It can happen during pregnancy and after. And so when you really want to seek help is if you have a lot of intrusive thoughts, if you cannot sleep, if you are having panic attacks. There are several different resources in each county at this point. There are therapists that are specialized in perinatal mood and anxiety disorders. You can log on to California Health Collaborative, and then they will give you a list of providers. The way to combat this is sleep. That's the first thing that we tell all moms to do, even if you're nursing, that sleep and eating well, not eating a lot of junk, not eating a lot of things with caffeine, will really help your mental health.
It's very important to take care of that. And as brothers, sisters, husbands, older kids, all the family needs to be involved, because sometimes the mom that is going through either postpartum depression or depression during the pregnancy, as aware as they want to be of it, they're not aware of the signs, and we can support them, right? Being attentive and alert to help them.
Most definitely. And so when we're speaking of self-care, we really one component of that is asking for help, right? Asking your partner to take the baby, maybe to feed the baby, to hold the baby while you get rest, or just have a moment away from baby or the other children. And it could be anybody within your family system that you oftentimes are connected with. It's kind of challenging with the social distancing, but again, if you're having panic attacks and you're really struggling with your mental wellness, you might want to reach out to a mother-in-law or a sister.
Yeah, and it's important that those sisters and those mother-in-laws stay attentive. I want to just welcome whoever just started tuning our conversation. We're talking about healthy moms, strong babies, expecting a baby, and caring for a newborn during COVID-19 pandemic. If you just tune, we invite you to stay. We have, like you see, 3 experts, 2 doctors, and also we have an expert that can help you where to get the help that you need during these times. Let's go and talk again with Dr. Aziz. Dr. Aziz, can you give COVID-19 to your baby during the pregnancy? It's something that a lot of pregnant moms are super concerned right now.
So that's an excellent question. And so one of the things that we have to say and have to consider is that we don't have tremendous amounts of information yet about COVID-19 and pregnancy and perinatal transmission or vertical transmission. However, so far, the literature that has been published has been very reassuring. And for the most part, we have not found the virus in breast milk or amniotic fluid, and in most of the placental pathologies that they have looked at. Now, there are case reports that are coming up, but that perhaps we may reconsider these things. However, we have to look at it at a large scale. Sometimes with case reports, there may always be a special circumstance where all of the information may be a little bit perhaps conflicting. So we have to wait for larger studies, for example. And so far, when we've put the largest case series together, we have seen that perinatal transmission, or transmitting the virus from mom through the placenta and through the uterus, it has not occurred at this time for COVID-19. So transmission to the infant is not possible through pregnancy.
What about breastfeeding, doctor?
Excellent question. Again, breast milk has been tested with multiple studies, and we still fortunately have not detected COVID-19 in breast milk. So it's very reassuring. So I would say that please take note that breastfeeding is possible during this process and during COVID-19 pandemic. If a mom is sick with COVID-19, there are 2 options. One is to continue breastfeeding, direct breastfeeding, where the baby is on the breast. And we just make sure that mom controls or has some type of coverage over her mouth so that coughs or secretions or runny nose can be all controlled, and we minimize those exposures to the baby. Additionally, we recommend hand hygiene. So please, before you begin the breastfeeding process, wash thoroughly and for a long time. And then with any, change or other contact with other things, make sure you wash your hands before handling the baby on the breast. And then finally, there are some moms where if they are too ill to nurse or may choose not to at a specific time if they're too ill, there is a pumping option. For example, you use a dedicated breast pump And you, again, washing hands, washing bottles very carefully, and especially if you can have somebody else who's not ill wash the bottle so that there's less contamination of the virus to any materials, for example, that are given to the baby or near the baby. And then a healthy family member or support person can then feed the baby until mom is well enough or decides that she is ready to nurse and to do direct breastfeeding again. So absolutely, yeah, for breastfeeding.
Thank you, doctor. That takes me to ask Shantae. For example, there will be moms that even though they hear this, it's great information comes from the expert, and they're still afraid. Then they decide, you know what, I'm not going to take the risk. I don't want to breastfeed. What programs can help these families who need help with food, either for those that want to breastfeed or those that don't want to breastfeed?
So that's a really important question. Thank you for asking it. And I feel like it's sort of a two-part answer. So first, I want to kind of go with what Dr. Aziz has said. As a breastfeeding consultant and educator, I will say that breast milk is best. It is the best way to feed our babies. And we know that, you know, there are certain barriers that may come up where some moms are not able to breastfeed, and that's okay as well. And we want to provide the most support and love that we can to all of our families to just make sure that we have babies who are able to thrive. So in terms of accessing other resources, breastfeeding support, I'll just quickly, 5 seconds, go through some probably common access points that we've heard of, which is reaching out to our local school districts, which have like grab and go meal programs. There's our food banks. I also want to put emphasis on our United Ways and calling 211 to get information about food. But then I also really want to highlight WIC, Women, Infants, and Children. WIC is a phenomenal program that is just, it offers so many resources to mom in terms of nutrition education, family support, breastfeeding education. For moms who are not able to, you know, breastfeed their babies, they also offer support with supplemental nutrition such as formula. So there are options in California. We know that breast milk is best, and if that's what you're trying to accomplish, there are definitely resources to help you. WIC is a primary one. I also want to say too that in California, we seem to have some, I guess, confusion around CalFresh and WIC, for example. So if the bottom line is, if you are enrolled in WIC, you can still enroll in CalFresh if you're eligible, and vice versa. You can have WIC and CalFresh. So I really want to make that clear, that it is okay to apply for both WIC and CalFresh. You can have both programs at the same time. And I know that, you know, I have limited time, but I want to mention something that's really important for Californians that we're doing, and that's called the Pandemic EBT card. So PEBT. So this is something that is new. This is $365 per child. And in California, if you are enrolled in free school meals, if you receive Medi-Cal, if your family is part of CalFresh or CalWorks, your child is eligible for $365. And that is a total amount between March and June. So you don't have to do anything in California. Actually, some families may have already started to receive their cards. They started going out last week. And if you do not receive your card, the online application will start on May 22nd. You have to apply by the end of June. It's a one-time benefit of $365 per child. And that benefit amount is good for 1 year. So I want to emphasize that it's called the PEBT card. If you get something in the mail and you don't recognize it, please don't throw it away. It is a real benefit. It's $365 per child to help ensure that our moms and our babies in California continue to have access to nutritious foods.
Chante, I want to ask you because I've heard of that today. I just have the question. This is for all the kids that are enrolled in the schools in California, or also includes those kids that have not started pre-K yet? Because I know
So
that if they are registered for the free meal or low-cost meal in schools, it'll go automatically. You don't have to do anything. But if you have a newborn to the age before they go to school, separated from week, they still can get that $365?
So here's, I think, the best way to understand it. There's always eligibility requirements, but I think in California, we can assume that most families will be eligible for support. And here's why. So there's multiple eligibility criteria. So if you are, for example, enrolled in Medi-Cal, and we know that more than half of our babies born in California are enrolled in our Medi-Cal system, then you automatically qualify. So it's Medi-Cal. It's if you're also enrolled in a free school meal program. It's also if you are part of the foster care system. It's also if you're part of CalFresh or CalWorks, right? So perhaps you are not part of the free school program, but you are enrolled in Medi-Cal, or you are enrolled in CalFresh or CalWorks. So there's multiple different layers of how California has been really proactive in ensuring that we reach all of our vulnerable populations to make sure that we continue to support access and nutrition among our families.
Thank you, Shante. That takes me to ask Dr. Alexandra for help. Where can women get help when it comes to their mental health? Shante is talking about food services, but we can't forget about our mental health too.
Yes, thank you. So I kind of want to piggyback on Shantae's comment in regards to WIC. So two things. You can access WIC services while pregnant. A lot of our moms don't realize that that is a resource that they are usually qualify for. And WIC has started screening moms for perinatal mental health complication as well. So if you are at WIC and you are feeling a little anxious, let your WIC administrator know that. Your OB doctor is now required to screen all pregnant and postpartum moms for perinatal mental health, and it's just a survey online. And that survey, it's called the PHQ-9, Patient Health Questionnaire. And you can turn that into either your OB or pediatrician. Some of our local pediatricians have started screening because, again, moms tend to take care of their babies first. And so we have found that a lot of moms will disregard their follow-up visit with their OB provider, but then go ahead and take their baby to the pediatrician. A lot of our county programs like Black Infant Health, you can let them know that, I'm feeling a little depressed, anxious. And again, if it lasts longer than 2 weeks, that's really when you want to seek out services. Or you can look online, but be careful with Googling. You don't want to over Google complications with your mental health because it might make you more anxious, or watching the but those are ways you can access services.
That's great. Thank you, doctor. We're getting some questions from the viewers on Facebook. This question comes from Diane. Dr. Assis, I'm going to send this one to you. She's asking if mom can pass antibodies to babies.
That's a great question. We do not have a lot of evidence, actually, even about a mom's antibodies herself in terms of how protective they may be for herself. Usually, antibodies that are developed, and if a mom is pregnant, the IgG or the long-term antibodies do pass through the placenta. So we know that of all viruses, for example, that mom produces some antibodies, the ones that are the long-lasting ones, that can cross the placenta and can actually provide a bit of passive immunity for the infant once the baby is born. And that's the thought behind vaccinations for pertussis, for example, and for influenza, which we really very much advocate and support during pregnancy for pregnant women. So at this time, we don't have many studies about the antibodies that are transferred to babies from their mothers, whether it be through the placenta or through breast milk, for example, which is IgA is one of the antibodies that's passed through breast milk. However, I'm sure those studies are in effect right now, but we don't know very much about them and how much protection they will provide the infants. We actually don't even know how much protection the antibodies provide for the person that has them and demonstrates them at this time for COVID-19, just because it's so novel, so new, and we have not seen the history of it yet as it's occurred in multiple seasons, for example, in one individual. But on a general note, antibodies, yes, are transferred to the baby through a placenta and through breast milk, and that they may be protective for a period of time because they last for several months, for example, in a baby's body, and that they may provide protection for other infections, for example. So we don't know yet about COVID-19.
Well, you mentioned that it's so new. We don't know much information. Makes me think of
Yes.
this article I was reading about Italian women that were planning to get pregnant. It decreased dramatically the amount of ladies that say, now I don't want to, I want to wait. And that takes me
Yes.
to the question that we received from Alex on our Facebook. Alex is asking if women are discouraged from trying to conceive during this time. If so, how long should a woman wait?
So that is an excellent question. And I think that, again, I hate to use this same reply, but because we don't have that much information, we really have not given a recommended time to wait before trying to conceive. One thing is obviously once somebody gets the infection, on average, the regular time of viral shedding is generally about 2 weeks. And after 2 weeks, typically an individual no longer has the virus in their system. That being said, there are studies that, of course, can outlast that. And there are some studies that show that whether it's a severe disease or for other reasons, some people will actually shed this virus for a longer period of time, maybe even up to 42 days or 6 weeks, for example. On another note, there's also studies trying to see if the virus is detected in semen. So again, this whole sexual transmission process is being studied. At this time, we actually don't have conclusive data for much of this transmission process. I will say that typically individuals will have the virus for approximately 2 weeks in which they're shedding the virus and are contaminate or can transmit it to others, and that would include a sexual relationship if it's sexually transmitted. But at this time, we really don't know if it's sexually transmitted. And so we're not making any significant recommendations about waiting to conceive. And I think the studies are out there and we'll be probably giving some recommendations or more knowledge about this as time goes on.
Yeah, that makes me ask Dr. Alexandra, doctor, some people are actually very discouraged because they're afraid. And sometimes, the fear paralyzes you, but at the same time, if it's your time, you get pregnant and then you're in the middle of some sort of abusive relationship. How can a woman overcome this? The fear, and on top of it, then the partner may be abusive because the partner decided that it's her fault to get pregnant when they shouldn't get pregnant. So what advice can we give to those women?
Yeah, so typically women are planners. We know now that when women are in domestic violence relationships, sometimes they're just not ready to leave. Now, granted, we want them to leave that day, but that's not always an option. So we say, start planning. What are some things you need to look at? Who's your safe person? Start getting documents together. Maybe open up a PO box or a new bank account. And we get that that moving other children are moving while you're pregnant can be challenging. Housing is challenging. But again, we really just want to start planning, practice eating and sleeping well, and that all impacts your mental health.
Yeah, it's important to have, a plan, like you said, a balance. We receive another message from Rochelle. she's just sharing with us. She doesn't have a question. She's sharing that Black Infant Health, it's a great program for African American moms to be. I'm
Most
sure
definitely.
Shantae, that Shantae, you know about these programs, and you've been talking about all the programs are out there. A lot of our communities, women of color are also concerned because in some circumstances we are in disadvantage.
Right. Yeah, I thank you so much, Rochelle, for asking that question. And before I answer directly, I just want to sort of acknowledge what Dr. Alexandra has said in terms of intimate partner violence, I'll say, versus domestic violence. We know there's actually a lot of data that demonstrates that intimate partner violence increases when you are pregnant, especially when you're a woman of color. And so in terms of, for example, opening a separate bank account, getting your sort of plan together, if you will, there are some different financial resources that are available. And I know we're going to talk about that a little bit later, but I just want to kind of put it on the radar that it is okay to say this out loud, that this is a challenge, it's a problem. And as California women, we are sort of here together as a team to work through these issues. And I think it really needs to be okay, like Dr. Alexandra said, for example, to identify who is your support person, who do you trust. Maybe it's, your doctor, Dr. Aziz, who might have some information or resources, right, that can help you like get started. But it's really important to identify your transition team, if you will, and what your transition plan is, because it may not happen on Monday, but maybe it can happen on Friday, for example. So I just want to just put that out there, that we're all women in California together. We're all in this together, all fighting for the same thing. Now, as far as our different programs, yes, I am absolutely just over the moon about our Black Infant Health Program in California. And I think it's important to highlight, we do have disparities, and I think COVID-19 has really actually highlighted some of the disparities that we know exist. We know that Black pregnant women, for example, have higher instances of comorbidities in terms of high blood pressure, heart disease, and even intimate partner violence, for example.
Yeah.
And so we also know that there's lots of data to show that Black women in California and across the nation really have higher rates of feeling socially isolated. We know that a pandemic like COVID-19 is something that really is something that can just really just amplify this feeling of being isolated or feeling socially isolated. And so the Black Infant Health Program is still going strong. They are still accepting women across the state of California. It is a social support program, and it is there to really help support Black women through their pregnancies, to help navigate just the experience of being pregnant and Black in America. And that's a really interesting thing to say, because we know in America, we have these huge Black-white disparities. Women of color in general, so Hispanic, Asian, Black women, we have disparities, but when you look at the Black-white disparity, that really is sort of the jaw-dropping, like, oh my gosh, how is this happening in California? And so I appreciate the question, and I want to acknowledge that, yes, Black Infant Health is one of our core support programs that we do have in place. And again, the Black Infant Health Program is accepting new enrollees. They're fully active. They may not be meeting in person right now, but they are still providing one-on-one support and resources, and they're supporting, providing a very needed network of social support. So I encourage all Black women in California to reach out to their local Black Infant Health Program and enroll.
Thank you, Shantae, for that. We've been talking about through this time about services, financial services, mental health, food, different programs, different options, responded some questions. I want to go with Dr. Aziz and ask you the moment. I delivered 4 babies. I just remember getting in the car, running to the hospital, and one of my kids was born right there. I didn't make it. It was like right in the parking lot. How am I delivering a baby be different right now with this COVID-19? What different steps we need to take to make sure we're safe?
I think that's an excellent question. And I just want to thank you for sharing your personal experiences, because it really does connect all of us together. It connects me to you. It connects the viewer to you. And it's really lovely. So there are changes that are occurring in our labor and delivery system and delivery process during this COVID-19 pandemic. One of the things is that many hospitals, for example, are now requiring that all patients be masked during the entire process of their admission and postpartum recovery and until they go home, for example. And it does not matter if you have COVID or not, if you have symptoms or not. It's for everybody. It's a means of protecting everyone. It's a means of protecting you from giving things to other people and other people from giving things to you, for example, transmission of respiratory droplets. And motherhood and a baby, I can't think of anything else that's more celebrated unanimously by all cultures. Unfortunately, given our situation at this time, many hospitals have different rules in place for visitors, for example. Now, there are many hospitals that will still have one support person allowed to join the pregnant woman so that throughout her labor, delivery, and postpartum course. So I would highly suggest to check in on the hospital that you'll be delivering at so that you'll know what to expect and to prepare yourself for that in a way. And of course, for those people that can't join you, this is the age of video and FaceTime. So we have really been creative in terms of including our family members in our visits and doing that. And it's been and thank goodness, medical record systems are very equipped for that and are supportive of that. So that's wonderful, where we can do live chats with family members that can't be present either at the delivery or at an appointment, for example. And then finally, if a mom is positive and is in the delivery process, there are, I think that we just need a good multidisciplinary support system. So that includes the OB, that includes our pediatric team, and that includes our infectious disease doctors and infection prevention and control. So a mom who is COVID positive will be in a special room that has negative pressure so that it can decontaminate the respiratory droplets as much as possible, for example. Additionally, she will be given the option to be able to stay with her baby, but approximately 6 feet apart in an isolette, and to still be there with the baby in the same room, or if a mom is too ill or if she decides otherwise, there may be a separation process that is very, very important to discuss in advance. I think that is the most important thing, is that preparation and knowledge are really key to making this very difficult transition period as soothing, nurturing, and reassuring to our moms and our babies as possible. So those are some of the things. And then for going home, we provide education material for how to keep your baby safe as well and healthy for all infections, right? I feel like all our infections are going to go down, given that so many of us are using masks and doing excellent hand hygiene and using precautions and etiquette that really try to decrease transmission of respiratory illnesses. So I think those are some of the things to think about. Again, I hope that the mom will be delivering at a hospital where there will be one support person allowed. It's very challenging to be in this situation and to go through labor and delivery in this COVID pandemic. And I would just want to also, on the bright side though, just say that fortunately, unlike some other respiratory viruses that we've experienced in the past 2 decades, COVID-19 seems to not affect pregnant women more harshly or more severely or with more complications or deaths or ICU admissions than the regular population. I'm not saying it's a mild infection. It can be severe in certain individuals, but fortunately, being pregnant does not make you at a higher risk. There are other comorbidities that make you at a higher risk, and we need to optimize and take care of those things because those things can occur in pregnancy. For example, diabetes. Lots of our moms are diabetic, and we need to make sure we take great care of them. That's a high risk factor. But at the same time, pregnancy alone does not put you at a significantly increased risk for adverse outcomes for COVID-19, which is what most of the information has been saying to date.
Thank you, Doctor. I want to remind whoever just joined in our conversation, we're talking about healthy moms, strong babies, expecting a baby and caring for a newborn during the COVID-19 pandemic. This is something that it's bring to you by March of Dimes with the support of Cedars-Sinai. I have a question in line with what you were talking about, Dr. Aziz, but to Dr. Alexandra. For example, we're planning to go to the hospital. Doctor just explained how everything needs to be done, prepare, and the hospitals are doing their portion. The hospitals are doing an incredible job. They are the real heroes without a cape and a sword in these days. We know that they're having restrictions in some hospitals more than others, and everything is treated either city by city, county by county, or hospital by hospital. What if my partner cannot be with me in the hospital, Dr. Alexandra, and that will give me more anxiety? What will be your best recommendation for the mom that it's ready there? She made the arrangements, she talked to the nurse, and with the last 24 hours, the hospital changed some of their guidelines to make sure everybody's safe.
Yes. So some hospitals will have support people, also known as doulas, that can be there with mom. Really just being present at that moment, right? To just deliver that baby. But I do want to kind of piggyback on kind of our team as we're pregnant and delivering during this time. If you have a history of depression, anxiety, you might want to reach out to a therapist within your community. Maybe you don't need to seek services today or tomorrow, but maybe really start interviewing therapists. I oftentimes say that similar to a dentist, similar to a pediatrician, a family should always have a family therapist or a family psychologist that they know. You don't want to access this individual when you're in crisis, right?
Yeah.
Because you want to have that person. You want to make sure that she's a fit, your personalities, how you see life, mirror each other, because it is a rough time. And to not have your family present while you deliver a baby is going to be challenging. That's just something we're not used to. But again, we're doing our best to keep you and baby safe and healthy.
Thank you, doctor. And I'm going to take a little bit of that, what you just explained is rough times, is difficult. Chante, many people lost their jobs. They're just unable to work right now. Some people won't be able to work again in a very long time. What financial help is available in California? Because if they feel like they have financial help, this will give them, you know, stability mentally. They're bringing the main, covering the needs of the house.
Right. Absolutely. I agree that understanding, you know, how we can stabilize our homes right now is absolutely imperative to ensuring a post-COVID-19 recovery, if you will. So I won't spend too much time talking about things that we know of, you know, such as, you know, applying for CalWorks or unemployment. I will, though, highlight two things that I think is important in terms of disparities in women of color. And that is, a couple of weeks ago, we heard that we have a fund for undocumented families in the state of California. And I think that's really important for families to know. But I also kind of want to lift up also some organizations who are focusing and realizing that when we look at our data and our outcomes, we have really big African-American COVID-19 disparities. So we have some funds for our undocumented folks. And we have, for example, in California, we have United Way really stepping up, for example, to address the African-American COVID-19 need. So if there are, you know, financial resources that are needed, I encourage all Californians to reach out to their United Way. I will say specifically that the Central Valley, Fresno, Madera United Way, and also the Los Angeles County United Way have been very active in ensuring that they are prioritizing funds for the African American community. And this really is a great complement to our undocumented population who haven't been able to access some of the available resources. I also want to say as well that the Central Valley Community Foundation has also prioritized funds for the African American population, which is really important. And again, this is going beyond what we know is available in terms of things like unemployment, CalWorks. But again, our foundations and our United Ways have been really active. And so United Way of Los Angeles County, United Way of Fresno, Fresno Madera counties, and then also the Central Valley Community Foundation in California have been really active in prioritizing funds to make sure some of our most vulnerable populations are not slipping through the cracks. And so, you know, I just want to say again, I know that we have local, you know, faith-based organizations. And again, this is just sort of going outside of our traditional resources, right? Like unemployment and things, to just know that you should reach out to your faith-based organizations, your United Ways, your foundations, because these are organizations who are doing grassroots work, who are really prioritizing populations that traditionally fall through the cracks.
Thank you, Shantae. I don't have too much time left, but I have one more question from Elenita. She sent it through Facebook. It's for Dr. Aziz. She wants to know, Elenita has asked about finding a MAT, clinic for pregnant women.
I'm sorry, what, could you repeat the question? I didn't hear it very well.
She wants, she's asking about finding a MAT, clinic for pregnant women. MAT, M-A-T.
Funding a MAT clinic?
Finding, where can she locate a MAT clinic?
I'm so sorry, I don't understand. So a
Don't
MAT
worry.
clinic?
Look, what we can do, we're gonna answer her on the FaceTime message so we can elaborate and give her a correct answer. Maybe there's more into it, but we don't have that much time left. We just have pretty much 2 minutes. I just wanna ask each one of you in 30 seconds, please, not more than 30 seconds, to give us a last message for the moms that are pregnant right now. Let's start with Dr. Alexandra.
Yes, so 1 in 5 women will suffer from a perinatal mood and anxiety disorder. And within the African American population, it's 44% in comparison to Caucasian women, which is 31%. So again, I just reiterate, I feel like every family should have a mental health provider, similar to their OB and pediatrician. So be mindful of that, start interviewing women or mental health providers, and have her a part of your team.
Thank you. Shantae?
Thank you. So I will just follow up with that and say that our first point of contact in terms of just not feeling socially isolated during this time is to reach out to our friend and family networks, whether that means making a phone call when we usually text so that we can hear someone's voice, or, you know, doing a Zoom or a FaceTime. But in terms of resources, I just want to remind our Californians that our fathers and our partners are also a huge source of support if we only ask them to be engaged and part of the process. So remember that our male partners, they are a source of support. And so let's reach out to them and ask them, you know, to be our support partners. They can be our doulas right now. They can be our partners, our fathers, and everything else. So that's my parting word, is just to remember that we have family, friends, and let's not underutilize our male partners out there.
Thank you. Dr. Aziz.
So I would like to extend the invitation that please please come for prenatal care. I think it's very important to initiate your prenatal care even in this pandemic time. And I do think that your obstetrician, because of the constant support and contact we have, is a great source of support and advocacy for pregnant women at this time, especially and beyond the typical medical care that we often provide. I think this is a very challenging time for many, almost all people, and I highly encourage everyone to please note that we are taking every precaution to minimize transmission of this infection and to make everyone and keep everyone as healthy as possible. And so I would encourage you to take that step to get care and to stay healthy, and we will be there with you. And there's nothing more beautiful than a mom and a baby. So I just have to say that we want to keep that really the thing that motivates all of us to be here, to keep that feeling and to keep that passion alive even through this pandemic, because it's the silver lining of everything that we can still move on, and these beautiful little babies are born, and we want to keep everyone, moms, babies, and their entire families healthy. So, and I think we can do that together in this joint venture.
Thank you, doctor. We want to encourage everybody to visit Marshall Dime's website at marshalldime.org/COVID-19 and the Marshall Dimes blog, news.marshalldimes.org, for the most up-to-date information on COVID-19, pregnancy, and new babies. And for you that had some questions and you couldn't get them answered, please like the page of Marshall Dimes California and this Facebook transmission, and then you're gonna get an answer to your question. Like the link, promote it, share it with your friends. Remember, Marshall Dimes is here helping everybody. Even if you are tuning and you're not in California, I'm sure that if you send a question, you will get the answer that you're looking for, because what they've been doing for decades is just help moms to be healthy, have healthy babies. You have all of the information on the screen with all of the resources. And through our three experts today, Dr. Assis, Dr. Abawatan, Dr. Alexandra, and Shante Balch. Thank you so much. Thank you for the privilege of being a moderator today. It was an honor for me. And stay healthy, everybody. Thank you so much.